Moved to the new chapter, sexually transmitted infections. This transmission is by sexual contact or by placental transfer, and infected needles or in blood transfusion can cause STI, and incubated infants mucosa when passing birth can all. See, contact transmit everything. Placenta transfer agadu HIV and syphilis. Blood transmission HIV, hepatitis B and syphilis, and inoculation of the birth canal valiya pass agaradu you can say coccus. So through this it can be spread. So mostly we have to find whether what is the cause of the sexually transmitted disease. When a bacterial cause irukkalam, fungal cause irukkalam, parasitic cause irukkalam, protozoal cause irukkalam, viral cause irukkalam. So risking factors yaarukkalam prominent it can be risk factors risk factors people who use pills contraceptive intrauterine contraceptive device use panni STD prevent panna mudiyadhu. Only barrier method by using condoms and diaphragms, only then STDs can be prevented. Others cannot prevent STI. Lack of sexual education and practice of safer sex should be advised to prevent these. First we are going to see about gonorrhea. So gonorrhea is one of the important health problem. See, in this we have to write the signs and symptoms. We have to see the examination points and complications of the disease, treatment and prevention. So first, it is caused by Neisseria gonorrhoeae. It is a gram-negative bacteria. So incubation period 3 to 7 days. So 1 week you can see the incubation period. Appearance of symptoms can be seen. And yes, the primary site of infections is endocervix, urethra, Skinny's gland and Bartholin's gland. So 4 endocervix, urethra, Skinny's gland, Bartholin gland. Anga enna infections varum, urethritis varum, Bartholitis varum, cervicitis, ella inflammation anga varadnala indha conditions la ungalku prominent ah irukum. And these are if 15% untreated irundichu in the cervicitis, in the infections line untreated irundhuchna, it can lead to acute pelvic inflammatory diseases. Most commonly endometritis and salpingitis commonly it can occur because through the sperm transfusion it can affect all the parts transported through it. And later we have to see the signs and symptoms. Symptoms will be asymptomatic. Mostly they will not have any symptoms, but if the locally symptoms seen they'll have dysuria, they'll suffer from dysuria, they'll have vaginal excessive irritation, vaginal discharge will be occurred, and the acute unilateral pain will be seen. Swelling in labia will be seen because of the involvement of Bartholin's gland. So Bartholin gland la site of infection inflammation Bartholin's gland site of infection labia inflamed ah irukum. There can be discomfort in the rectal discomfort seen, and there can be intramenstrual bleeding. So labia signs labia will be swollen and inflamed. Discharges will be mucopurulent. External urethral meatus will be congested. On squeezing the Bartholin's gland, pressure squeeze purulent exudate escapes out to the openings. So, and Bartholin glands will be palpable, enlarged, tender with formation of abscess. So, liquid form abscess irukradnala. Speculum examination reveals congestion of ectocervix. So, inga the urethral meatus site of infection ellame will provide you a sign. Inga urethral meatus congestion, inga abscess agadnala secretions adland varudhu, Bartholin gland is affected, and then endocervix also will have congestion will be seen. So complications we can see acute pelvic inflammation will lead to chronic, and also they'll have infertility. Ectopic pregnancies can be seen due to the tubal damage, and dyspareunia can be seen, and tubal ovarian mass can be seen, and Bartholin glands abscess will be commonly seen. So for diagnosis, you need a NAAT test, that is nucleic acid amplification test, that detects the genetic mutations in the nucleic acid. So we can see that acute phase secretions or the secretions from the Bartholin gland, endocervix, inflammation adlend vara secretions, you can send it for germs to detect the cause of the secretions and all the symptoms you can find. Then in that we can see the gram negative bacteria, that is called gonorrhea, can be detected. So effect of pregnancy it can spread from the mother to child. So gonorrhea can spread from a mother to child, and it can cause infertility and birth defect, and it can cause birth defects to the child. Skin problems or blood related problems or brain related problems can be seen in the infant. So simultaneously the male sexual partner also should be treated, and they should avoid multiple sex partners, and they should use condoms free from diseases. Most of the time the curative suspect that they have syphilis or chlamydial infections. Tuja and natrum sulf can be given as homeopathic remedy. Let's see syphilis in the next video. So stay tuned for the next episode. Bye.